Welcome to Bench to Bedside, a weekly series of live conversations about recent advances in cancer, from the research bench to treatment at the patient's bedside.
Right at Thanksgiving in 2015, I was diagnosed with breast cancer. The first thing you think of is, I'm going to die. That's the first thing you think of. I had my double mastectomy on Cinco de Mayo of 2016.
They already have the thought process going through their head that, I know I have breast cancer, I know my breast may need to be partially removed or completely removed, and they're thinking, what's the next step? How can I get my breast back again? So it's Breast Reconstruction Awareness Day. It's a promotion by the American Society of Plastic Surgeons to help consumers know about breast reconstruction.
You just don't realize. You think people get implants after they have a double mastectomy, but you don't think about how it's going to take place.
The first step we talk about is tissue expansion, which involves putting the tissue expander in to help establish a breast space again. And we'll continue to inflate that expander in the office over the next several weeks, which will reestablish a breast space. And then from there, we can remove the expander and put implants in, or tissue-based reconstruction, all depending on the patient's choice and some of their treatment options. And at the very end of all of their steps of reconstruction, we'll do a nipple and areola reconstruction if they want. So that actually is kind of the last step that signifies the breast is done.
They had to take my nipples. So when I got the tattooing, that's when I felt the most complete. And when I looked at them, I broke down and I cried because I looked like myself again. Here I am 18 months later, and it's like it's really never happened.
We get to reconstruct people to make them whole again.
There is definitely life after mastectomy.
1 in 8 women will be diagnosed with breast cancer in their lifetimes, and 7 out of 10 of those women will not be informed of their breast reconstruction rights and options. Women who are diagnosed with breast cancer should know their breast reconstruction options and that their reconstruction is covered by medical insurance. It's our responsibility as physicians to inform them of these rights and options. One way to focus awareness on this all-important aspect of breast cancer care is through Breast Reconstruction Awareness Day, or BRA Day. At the University of Kansas Cancer Center, our breast plastic surgeons recognize BRA Day annually. With me to talk about BRA Day are Dr. Richard Korentager and Dr. Michelle Souza, plastic surgeons who specialize in breast reconstruction at the University of Kansas Health System. And I'm Dr. Roy Jensen, Director of the University of Kansas Cancer Center. Thanks for joining us for today's episode of Bench to Bedside. So Dr. Korentager, what types of breast reconstruction options do you discuss with your patients?
Well, I think it's really critical that we discuss all of the various options with patients. Sometimes people will come in with very specific ideas. So what I like to do is go through all of the options, really from doing nothing all the way up to doing the more complex forms of reconstruction using their own tissues.
So Dr. Souza, what are the key phrases that patients really should be aware of when you're talking about breast reconstruction?
The key phases of breast reconstruction, it's often a multi-surgical approach. The first stage we'll start at the time of the mastectomy, which we call immediate breast reconstruction, and often we start by placing a tissue expander. The tissue expander is inflated in the office over several weeks, and then we would take it out at a second surgery and place either an implant or place tissue. It's also important to know that we're involved, as plastic surgeons, we're involved with breast reconstruction even for partial lumpectomy defects or partial breast defects, and that's called oncoplastic reconstruction.
So Dr. Korentager, what are the most common questions or considerations that you address with your patients?
So with my patients, one of the immediate things that they always want to know is, how long is this going to take? Will I be able to start the process right away? And that is something that can become a pretty complicated discussion with patients. It depends on the type of cancer that they have. It depends on the plans of the breast oncology surgeons and all of the breast oncologists that are working with the patient. there's also been a lot of change over the last number of years in how we perform the breast reconstruction cases. So there are times when we're able to do an immediate breast reconstruction using implants, where we can do what's referred to as a direct-to-implant reconstruction. If we're able to save, if the breast surgeon is able to save a lot of the skin, a lot of the soft tissue envelope, we can go direct to implant. So literally the patient goes to sleep, has their operation, and wakes up with a reconstructed breast, allowing us at sometimes to avoid even the tissue expander stage, which can really give people a lot of comfort.
So Dr. Souza, what concerns do women typically have relating to specific types of cancer or their reconstructive choice?
So they'll want to know if it's an option to have breast reconstruction, and sometimes it depends on the type of cancer they have. That's why it's important for us as plastic surgeons to have a consultation with the patient as early as possible, early in their breast cancer diagnosis. It's important to know that the decision about performing breast reconstruction and their breast cancer treatment are kind of planned in the beginning.
So if you're just joining us, we're here with breast plastic surgeons Dr. Richard Korentager and Dr. Michelle Souza to talk about Bra Day and the importance of women knowing their options when it comes to breast reconstruction. Remember to share this link with people you think might benefit from our discussion. Use the hashtag #BenchToBedside. So Dr. Souza, how can friends or family members support someone who is undergoing breast reconstruction?
Well, I would encourage them to come to the consultation and attend their appointments with them. Be their eyes and ears, because there's a lot of information that we'll offer to share with them, and in addition to the breast cancer diagnosis. So it helps if there's another person or people there that the details aren't missed. As far as the reconstruction goes, things that will help would be to cook meals for them, cook meals for their family, help clean their house, help take care of their kids, because initially after surgery there's some recovery and those things will be difficult. So it helps for the patient to know that those things are taken care of. Eventually they'll get back to their routine, but initially those things will be very helpful. And I think it's also important to help find the silver lining for them. They don't always want to talk about their breast cancer diagnosis, so it doesn't have to be weighed down by that.
Mm-hmm. So Dr. Korentager, where should women go for more information?
There's lots of different places. So I think our website at the University of Kansas Health System and our plastic surgery site has got a lot of really good information. The American Society of Plastic Surgeons has got a very good website that has got lots of up-to-date information and also links to other areas. The American Cancer Association is another one. I think probably the most important thing is that people are careful about where they get their information, because just because a website or something looks very professional doesn't mean that it's going to have information that is going to be accurate. But really, the single best place to get the information is at the consultation with the plastic surgeon, because we're the ones who are going to be able to sort of put everything together and really help women understand what their options are. And I just want to mention one thing. I just said women, but I think it is important for us to also point out that breast cancer is something that affects men as well, although much less frequently. So for men to get this information, they really do need to talk to healthcare providers, people through the Cancer Center who understand their risks as well.
Mm-hmm. So kind of following up on that, Dr. Souza, what are the advantages for women who seek care at an NCI-designated cancer center such as the University of Kansas Cancer Center?
So as the region's only NCI-designated cancer center, women that come here for treatment have access to clinical trials and all the latest treatment options. The other thing that we do at the Multidisciplinary Women's Center, the Women's Cancer Centers, we involve a team approach. So that's where we bring together multiple key team members, from the plastic surgeons to the breast surgeons, the medical oncologists, the radiation oncologists, the geneticists, pathology, radiology, and the lymphedema specialists and the breast cancer nurses. Will all come together early on in the diagnosis to formulate a treatment plan that is comprehensive.
Mm-hmm. So from my standpoint, it seems like the key considerations for a woman considering this option is cosmetic outcome, the complexity of the procedure, and then the potential side effects. And could maybe both of you discuss how all of those things interplay for a specific patient, and why, say, a woman across the street did one thing, and why another woman who's her friend took a different option, and how all that works out in a practical sense.
One of the things that I always tell women whenever I see them for these consultations is that this is a part of their treatment where they're really in charge. And when they come in, we always are going to be trying to give them all of their options. And one of the beauties of our cancer center approach is that we're able to offer every single option that's available anywhere in the world. And the outcomes that we've been able to demonstrate and that we've published are as good as anywhere in the world. So I think that gives women and their families a lot of comfort. We don't have just a single technique that we have to apply to individuals across the board. Also, within our Department of Plastic Surgery, we've got multiple surgeons who do implant-based breast reconstruction. We have multiple surgeons that do the free flap or microvascular breast reconstruction. We all work together as a team, which allows us to make sure that we have provided the best treatment for the women all across the spectrum.
So maybe could you give us an example of where an implant is the right decision for one patient, and a tissue-based reconstruction is the right decision for another patient?
Women that will choose an implant-based reconstruction, their recovery tends to be a little quicker because you take the expander out and put the implant in, or at the time of the mastectomy, they have the implant and they're done. But they should know that the implant is not something that's meant to last forever. And so there will be maintenance surgeries or replacement of the implants in their future. If they opt for tissue, the advantage is that it's their own tissue and it lasts for the rest of their life. The surgery is a little bit bigger and more complex because of the details, and that's why we have surgeons that specialize in that type of surgery. But those are the major differences between tissue and implants, and often it's the patient's choice. Sometimes it's kind of directed based on their cancer diagnosis.
I think the other thing that's important to add there is that the body habitus or the body shape of the patient may have an impact as to what is the right form or what is appropriate. In some women, using your own tissues just may not be an option because they don't have excess tissue to transfer from one part of the body to another.
Or maybe prior surgical procedures might have removed that as an option.
So Dr. Korentager, what would you most like our audience to take away with them today from our discussion?
I think the most important thing as a takeaway is that women should have the option. It doesn't mean that all women are going to want to have breast reconstruction or it's appropriate for all women, but I think it's absolutely critical that women be given their choice and that they be given all of the various options that are available to them so that they can choose in consultation with the plastic surgeon what is the most appropriate thing for them.
Mm-hmm. And same question for you, Dr. Souza.
Yeah, other thing that I think we should mention is that it's not always for a breast cancer surgery. Sometimes it's prophylactic and people have a genetic tendency to form breast cancers, and so therefore they're having the mastectomy as a preventative measure. So we do reconstruction for those women as well. One thing that we say in our plastic surgery society is that as breast reconstruction surgeons for Breast Reconstruction Awareness Day, what we're trying to do is close the loop on breast cancer.
That's a great point to end on. So I want to thank you, Dr. Korentager, Dr. Souza. That's it for today. To learn more, please visit kucancercenter.org and join us next time for Bench to Bedside. Thanks for watching.